I'm Dr. Jayashree Bhatt, a general ophthalmologist, call me a community ophthalmologist. 10 years I was doing typical ophthalmology. From 2015 onwards, because of my interest in preventive healthcare and diabetic eye care, I have been part of a couple of health IT companies. One to mention is Robert Bosch Healthcare, wherein we devised a retinal camera. I was part of the team which was about validation of images and building AI. That kind of opened up my interest into healthcare technology. And after that, I have been a consultant and an advisor for several digital health companies, startups. Currently, as I speak to you today, I am running my own multi-speciality center in Bangalore called Identity. It's mainly into preventive eye care. And it's basically, we have four specialties: eye, skin, nutrition, and mental health. And we are trying to adopt technology into every aspect, including mental health. And I'm also the eye specialist and consultant ophthalmologist at HCG Cancer Hospitals. I am working with a startup from Norway, where we are building a retinal camera. So this is my introduction, and my talk is etiquettes in teleconsults. Shambhavi?
Yes, ma'am.
Would you play the recorded version, please?
Yes, ma'am.
I'm a private practitioner in Bangalore, a single doctor specialty.
Hello everyone, my name is Dr. Jayashree Bhatt, and the topic allocated to me is etiquettes in teleconsults. And let us begin right away. We are living in a VUCA world, a volatile, uncertain, complex, and ambiguous world, and we are faced with constant, unpredictable changes, which is happening at a pace much faster than before. And the new normal that was announced as the Telemedicine Act brought teleconsults into the forefront. In ophthalmology, the utility is, of course, limited, and we are trying to maximize it, as we are hearing from the other talks. However, still, as compared to dermatology or psychiatry or psychology, our utility is limited. Still, we do find teleophthalmology useful in, or teleconsults useful in the following scenarios, like ocular emergencies, minor injury, or as a first aid, for triaging our cases, the superficial eye infections like styes, or follow-ups of cases which have already visited us in person, and refilling of medicines for chronic diseases like glaucoma, second opinions, where the patient already has got reports from elsewhere and wants to discuss with you, and for long-term follow-up of cases like a mucor clinic case or a thyroid eye disease, wherein long contact period is necessary between the doctor and the patient. So why are etiquettes important? Because we are just not transferring treatment online, but we are also transferring trust and empathy towards our patient, which is exactly what happens even during a face-to-face consult. And the idea is to mimic a physical consultation as much as possible. These patients can be our potential patients who would want to visit our clinic either now or later. I'm sure it has happened with all of you that you've seen somebody online and then built that faith, and they came all the way to visit you in your hospital. These are patients who are typically tech savvy and whose education level and expectation is much higher. So we have to meet those expectations. And their reviews contribute to the online word of mouth. Also, by default, the whole consultation and prescription process here is documented and it's on records. So we have to be conscious about all the medical legalities. Etiquettes ultimately translates into patient experience, and now experience is everything. Nobody just asks about, did you get better? But what is asked is, how was your healthcare experience? And then we are all rated. Sometimes when the patient says, doctor, I met you because your rating was high, I feel no different from Ammi's biryani. Just saying. So what are the etiquette considerations that we need to have prior to a consult? Our choice of platform, our choice of internet, the choice of medium and ambience, everything becomes important. Now, when I say platform, when we log into a platform or we upload a platform which is built for teleconsults, we need to look at whether this platform is having adequate bandwidth, whether it will give us clarity in our video consults, how fast is it, and the ease of usage. Also, are we downloading this app platform from a very trusted source? www is a much less secure one as compared to an HTTPS. Is the platform compliant with telemedicine guidelines? How about the data security and the confidentiality? Does it comply with the cyber laws? Is it HIPAA compliant? Is there a two-step verification? All these are the questions that we need to ask the platform provider. Whether it supports both the Android and the iOS, or it supports only the Android version, whether it has both a mobile version or both mobile as well as browser versions. Can we switch between audio and video as is necessary? Because sometimes if the video starts lagging, then we'll have to immediately switch to audio. How about the commercials? Whether it is a subscription model or whether it is paid per usage. And one more thing, what we have to decide is whether we will go for a pre-existing built platform, which is available for several service providers, or are we going to customize something for ourselves? So basically, a pre-existing platform is for new patient acquisition, whereas something which is customized, we build for ourselves is for our old patient retention. So the internet prerequisites that we have to look into are whether, how comfortable are we, or how much knowledgeable we are with the smartphone, our iOS settings, the Chrome settings. We have to enable the audio and the video. Sometimes if we have blocked it, then we will not be able to log into the app, and we have to enable the audio and video for the app. The internet with a good speed is important. We have to be able to run a speed check on the internet. If the Wi-Fi is unstable, sometimes we'll have to give a direct Ethernet connection and use. And also it is better to have a dongle as a backup for the rainy days. Choice of medium, a video is always preferred over the audio because that is the one which comes closest to a physical consultation. A real time is preferred over a pre-recorded and already sent information, and always, even if the patient wants to send something on WhatsApp, a video is better off and not just pictures, because then we can assess the ocular motility, we can look for ptosis, etc. This was an example I've quoted in another talk. A lady sent her mother's picture and she said she has complaints of watering. So then the first picture was sent, and almost 20 minutes I explained about the different dacrocystitis and the different kinds of treatment options available, etc. Then the daughter sends the second picture saying that the first one was when the problem just started, and she thought she has to send the picture of how it looked like when it just started. And currently she's already operated and she still has some watering left. So what to do? So it was a whole lot of confusion. So it is very important to get the right history and to get real-time video instead of getting pictures. So during the consultation is our time of action. So I put it as light, sound, and action. Light is everything. Sometimes we can appear to the patient like this if there is a light source coming from behind us, or sometimes the patients appear like this to us, which is not a good scenario, because both we being very well visible to the patient and vice versa is important to establish that rapport, as well as clearly look into the eyes in the most magnified way as possible. And also sound has to be minimal. There shouldn't be too much of noise in the surroundings. In the second picture, again, it's an early morning phase and there is a bathroom door open. People could be going in and out of the bathrooms. The patient wants to feel that it is still a very professional consult happening in a quiet environment, and that sense of confidentiality is being maintained. So this is the best that I could do in the same room. It's all in a matter of 5 minutes. Thanks to our apron and thanks to the scrubs, we can immediately, resurface in a new avatar. So after the consultation, a prescription has to be given, without which it is considered as incomplete, and even medico-legally, a prescription is a must with the provisional diagnosis and our signature and the KMC registration number. Then we also have to be available for any other queries, and a refund policy, something that I do adopt. It is optional again. If I just feel that only 1 or 2 minutes I have spent and I do feel that this is not something which is suitable for teleconsult, I immediately abort the consultation, ask the patient to go to the nearest hospital and
initiate a refund. So the online prescription would look something like this, wherein even the generic name is written. And steroids, I do give steroids if I feel that this is frankly an allergy, and if some NSA prescribed by some other doctor hasn't worked. However, all the important precautionary measures that it shouldn't be overused, it should be tapered and stopped, etc., is told to the patient as well as also mentioned in the prescription. We can also create templates for common diagnosis and precept treatment protocols, so it makes the whole process faster. And a disclaimer is always best to keep in place that if the symptoms are not okay in a day or two, then they have to visit the nearest eye hospital. Of course, even the patient should have the same kind of etiquettes maintained when it comes to consultation. And we have to teach them those etiquettes because not many people are aware of it. That they have to log on time and they have to furnish right information. Suppose we are in doubt, we can always ask for their ID card. Sometimes the patients the people take appointments for others in their name, but when we send out the prescription, we have to make sure that it's the patient name which is mentioned on the prescription. The patient should also have a proper internet and proper lighting and sound conditions to give us a very clear and magnified view of both the eyes. I do not use any online tools for vision check, but I do ensure that in every case, irrespective of whatever their complaint is, I just make them grossly check their vision in both eyes, both for distance and for smaller print. And it is customary. Sometimes I also make them palpate on their lids to look for local areas of tenderness. If the patient is a minor and not so tech savvy, an attender has to be there in place. And also the patient has to keep the spectacles and reports within reach, and also share the reports with us as and when needed. So the ultimate take home message is that teleconsult is here to stay. And there's an estimate that the telemedicine Indian market size would reach about 5.5 billion USD by 2025. That's a CAGR of 30%. So if we can make that kind of money sitting at home with the minimal, gadgets, then why not? Thank you so much for the patient hearing. Hope you all enjoyed the talk as much as I enjoyed delivering it. Thanks a lot. So that was my talk. I'm open to any questions.
Dr. Jayashree, this is Dr. Saravanan here.
Hi, Dr. Saravanan. Good morning. How are you?
Good morning. Yeah, I'm doing fine. Thank you. I have one question.
Please.
Problem with teleconsultation sometimes is that both doctors can be rude and abusive, or even patients can be rude and abusive. So, and normally they tend to get away with it unless you're not recording the session. So, how do you actually deal with these kind of situations wherein you are faced with a rude or an abusive patient? Most patients tend to be all right as long as they get what they want. They get a prescription and they're all right. But then in the second consultation, when they're not doing well or they're asked to come back, then they sort of feel why we had to pay you for the first place, for the first consultation, if the things could not be sorted out on the teleconsultation. So how do you deal with this kind of a situation and take it forward?
Thanks for the question, Dr. Saravana. Maybe thankfully for me, I have not had an instance wherein I have been faced by a very rude patient. However, there have been instances where people do take objection. Like maybe it is not frank rudeness, but they do take objection as to whether, why is the second thing needed, or why do we have to come, etc. If we are in a position wherein we can hold on to our posture and make them understand in a professional way, we can, without being rude, by just being firm, we should be able to convey why it is so. But beyond that, if they cross a certain thing, I would abort the call. There is another doctor in my team to whom a certain patient was coming again and again, and he did not have an ophthalmic problem. He had some other problem, but he would continuously take appointment, and she actually got to me saying, ma'am, how do I deal with this? In fact, we don't have our in-house platform, and we are always going on platforms that are from outside, the commonly available ones. And we did write to the support team that one of the doctors is being, not really harassed, but wrongly being reached out to. And then that team took care of it. Have you had any instances wherein you have had to tackle such a situation, Dr. Saravana?
Yeah, especially during COVID, we were using this tele consultation platforms. So we used to use Google Meet for this teleconsultation. So what happened was initially patients were actually calling us when we were scheduling the appointments directly from their homes. So, but we found that we didn't have any control over the entire process. So we were used to a system wherein the doctor was having all the controls, over over what was being conducted in the session. But we found that direct teleconsultation, the patients don't take your advice seriously, and you can't even confirm the identity of the patient. For example, two people may look the same, and what happens is they sometimes even switch the identity in order to save the consultation fees, and then say that in the review things have not become better. So the problem is starting from documentation and this home consultations through teleconsultation is we found that it was not a very good method of conducting the entire event. So then we switched to a hybrid model wherein they were asked to come to our, because we had 3 centers, they were asked to come to one of our centers, and then where our optometrist did everything like workup and registrations, the reception test registration, so their identity at least is confirmed. And once their identity is confirmed, then they are offered 2 solutions. One is a teleconsultation module, and another is a direct consultation. So if they choose a teleconsultation module, they're seen immediately. So after the optometrist works up, so we in this kind of situation, we found that we had better control, because then they tend to behave themselves because they're in a hospital, and because there are other patients similar to them. So this hybrid model, we found that it was working much better than a direct home teleconsultation, because the patients sort of behave very frivolously when they're not dressed properly also, and you have those other issues because they are in their own environment, so you can't complain about it. So but then it's not professional also. So you are wearing a tie and you are wearing everything, but the patient is wearing a just something like a nightie, and then coming in.
Very true, sir. Yeah, these kind of scenarios happen. See, and thank you for your inputs. See, each one of us will have our own set of experiences when it comes to teleconsult, and this is still a very changing world. It's a very new thing. People are getting adapted. We are getting adapted, and that is why I also mentioned that it is our our duty to educate them, just like how we have educated them that when they come to the hospital, they are not supposed to chew pan or not come after smoking, or how it is that over a period of time, we have taught them the etiquettes of how to present themselves in a physical hospital. Same way, we need to now, it is on us to educate them about how to go about from a telehealth perspective. What has helped me personally is, even if the patient has my mobile number, I don't do a consult through my mobile number. I say, talk to the center. As this is my personal mobile number, this has been handed over to you by mistake. I do not take any consultations here. Please come through front desk. This is one standard. And the first 30 seconds or so, there is a ambience setting that I do. If they are walking around, I tell them, please, can you go sit down in a place, keep your mobile in a stable position, keep your hands free, and bring whatever is necessary for you to discuss along with me. It is not rude, but it is very strict. Like a principal, I tell. Okay, like some school principal. And it works. So the moment they know that, okay, this is a professional consultation, it is happening in this setting, they do respect most of the times. And the third thing is, in fact, for payment also, we have a very standard rule. We tell them that if it's coming through the platform, automatically the charges go to the platform. However, if we are doing through our informal medium like Zoom or our clinic WhatsApp number or something, then we do tell them what are the charges. This is my front desk has got a proper script. She tells them all that I have included in the etiquette stock now. It is told to the patient. You are supposed to be like this. You are supposed to keep your spectacles and records in place. If it is your father or your mother, you have to be with them. Make them sit like this in a good light. Doctor will come online at this time and she connects the call. Once the consult is over, the prescription is handed out after they pay.
So this is more like a hybrid online consultation.
It is. Sometimes it is hybrid. Like you said, we have to tweak differently. Like sometimes it can be a hybrid. Sometimes it will be, if it is through the clinic, sir, I have always gone through the hybrid model. And if it happens directly through a platform, then it is me, that initial 30 seconds, that standard instructions is there, how they have to sit, where they have to sit. They cannot keep moving around. And most of the times I've been, I think, lucky, touch wood, that I've not had very bitter experiences so far.
If they ask for a refund, if provided they are not responding to your treatment and they are not willing to come for an offline hospital visit, and they say that they are going to ask for a refund. So how would you deal with it?
Sir, a couple of times, if they have not got better online and in the next 1 or 2 days they have had to come to the clinic, we take a minimal registration charge, but we waive off the consultation charge because that has already been paid online. And online, they are not paying for getting cured; they are paying for our time. So sometimes they can get cured in one shot. They can get cured in 2 to 3 times. Sometimes you might have to call up for a follow-up, and they might get cured for that. So I do not do any refund if I have spent 15 to 20 minutes of my quality time with the patient online. There is no question of refund. And I have not given any refund in that matter. However, if I feel that immediately as I start talking to the patient, if I feel that no, this is not something which I want to handle online, I tell them, no, this is not something which we can do. Please go to your nearest doctor, and I abort it. Max, I would have spent 1 or 2 minutes, and I do initiate a refund. There are several apps where that is possible, where you say that you are canceling the consultation, it's not suitable for an online consult, and then the refund is initiated to the patient. This is what we do. And I kept my, one more thing to add, sir, I have kept my consultation charges for my physical consult as well as online same.
Okay.
Because they let us not create a discrepancy that the doctor is available for less online and she charges more if you go to the clinic. So at the end of the day, apart from the instruments, they're still paying for the experience, still paying for the time spent, and for the valuable advice and the treatment given. So it is equal, whether it is in the clinic or online. I've kept my charges the same.
Would you recommend taking a consent from them prior to the starting of the online consultation, wherein this refund policy and this package, wherein if they don't become better online, and then they will have to come back for an offline visit to the hospital. So is it offered as a package to them, and is a consent taken prior to the starting of the teleconsultation
No,
session?
sir, no separate consent is taken. It is like, I think even Dr. Sheila included in her talk in telemedicine guidelines also, it's mostly implied consent. When they are downloading the app or coming on the app, when they are coming on a WhatsApp call, or even when they come to our clinic now, every patient, we do not take, we as far as possible, we are trying to mimic a physical consultation. So when they come to the clinic, do we take any consent form that you have come now, you will get better. If you don't get better, we will give you a refund? No. So for online, this extra exercise is something which I am not adopting, and doubt whether it is really necessary. It is implied when they are reached you online. It is implied consent. Ma'am, Dr. Padmaja, you want to add something?
Yeah. So I think, as you said, it is implied consent. But what we have done is in the teleconsultation form, the first line will be, they also will get an intimation that by agreeing for teleconsultation, you actually provided the consent. There is a line included in their patient side app. And in our app also, we have the first line, whether the patient agreed for teleconsult, yes or no. And we click yes if you were able to contact. But it is more like a, as I said, the patient is also clicking that and then only paying for the money and then coming for the teleconsult. So we included that line that the yes provided the consent for the teleconsultation, and that the record also will show that there is a consent has been provided. Yes or no.
Yeah, even at Shankar Netralaya, we do the same thing. They tick for the consent, and then the payment, and then the payment is done before the patient comes. It's like the in-person also, you pay only income. The same thing.
It's the same thing. Okay.
Ma'am, could you walk us through how, ma'am, could you walk us through how you take the visual acuity of the patient, ma'am?
Yeah, so like I said, I have still not gone advanced enough to use any online tool, like how it's already got incorporated in the LVPI system. Grossly, I do make them, even if they come for itching, even if their problem is itching, I grossly make them if they are a glass wearer or if they are not. I make them individually check it and individually check it for near. In fact, I want to quote an example here. There was a teleconsult of during season 1 of COVID. I think 2020, there was a teleconsult. A boy came on a platform. He was around 27, 28-year-old IT engineer. He was in Delhi. And he said he's not able to see he's seeing blur from last 1 or 2 days. And I said, okay, you check for distance. He didn't find much difference. He said slight blur in left eye. And then I made him check for near. He did say he is having blur in the left eye, even for near. In my head, it was differential diagnosis. I mostly thought in terms of a CSR, but I told him, look, this is not for teleconsult. If there is blurring, then this is something that too also for near. It's not just about your spectacle power. Also, please go to the nearest eye hospital. He went. In fact, I looked on Google. I told him, this is the nearest eye hospital for you. You might get a doctor there. This was peak COVID time, 2020. And it turned out that he had a CRVO. Yeah. And then he came back on another teleconsult with all the reports of the tests done in that hospital. I told him, my job is done. Now you can continue to follow up in that hospital. So even that gross vision examination in youngsters for distance as well as for near, I've just made it a standard practice that I use. And now that today we are educated about, more tools online to detect visual acuity, I think one of the hurdles for teleconsults in ophthalm can be overcome through this. So our hurdle is that imaging is one hurdle, checking IOP, checking vision are the other couple of hurdles. So if we are able to cross these hurdles, then I think we can optimize and maximize the use of teleophthalmology to a much greater extent than what we are doing right now.
I think here I just want to say one point, that I think the more we collaborate and we do tele-networking, whether it could be the nearest vision centers, nearest our alumni, nearest our partners, any place, like for example, someone coming from eye identity place, they can just go to your clinic, get the basic examination, and they can have a teleconsult with us. Very true. I think connecting to the patient, as Devasmita said earlier, connecting to the patient or even your follow-up patient whom you have treated, I think you feel very satisfied. The patient will be satisfied to talk to the original doctor. Okay, I went to the local doctor. This is what all they said. Is this, I'm on right track? Even to the triaging also will help actually. Yeah, that's a wonderful point about collaboration brought in, ma'am. I think it's high time that we all start thinking on a collaborative manner. Earlier, we were from school time, we were only taught about competing. But now the time has come that, with collaborations, if we do not collaborate with each other, always there are third parties who come and try to, break into the system and, become beneficiaries. Usually, it's the third parties who become beneficiaries if we are not collaborated from our side. So I think that's a beautiful element brought in. And about continued care after the patient goes home. So this is another thing. Within us, we have to have that collaborative mindset. Okay,
this doctor is here, and we should all know each other that way. So this is a beautiful opportunity where we are all getting to know each other. This has to be extended, big cities to tier 2 to tier 3, so that more and more people can get access to, there is a referral network created, and more people get access to primary, secondary, and tertiary referral centers. And so that ultimately all of us are benefited, and more important, patient is benefited, and care is continued after the patient leaves the hospital. So the concept of continued thing, it improves compliances, like how Dr. Devasmita highlighted. Use of even the pediatric patients, where the mothers are getting demotivated. Now each time they cannot keep coming to the hospital. So if by a call we are able to keep up that level of motivation, then it goes a long way in just preserving the vision for the child. So continued care and leads to better compliance and better results for our patients. So that is a way forward, I guess. Thanks so much for this discussion. I really loved this discussion. We'll look forward for more. Now we would have Dr. John Davis, your presentation, sir. You would be talking about the use of smartphones in private ophthalmic practice.
Yes,
I have your intro here with me. Dr. John, you're a faculty in the Department of Ophthalmology in Sri Ramachandra Medical College, Chennai, formerly a glaucoma consultant, Little Flower Hospital, Angamalai, and Western Eye Hospital, Cochin. You've completed MBBS and MS Ophthalm from JIPMER and glaucoma fellowship from Arvind Eye Hospital, Pondicherry, and also completed the Ratan Tata Advanced Cataract Fellowship in Shankar Netralaya. You have presented state, national, and international conferences and won awards for smartphone-based virtual reality perimetry, smartphone ophthalmic photography, and virtual reality in ophthalmology. You have publications on innovations in ophthalmology, artificial intelligence, 3D printing, smartphones, slit lamp photography, and so on and so forth. You are highly into technology and gadgets, and you do programming, website designing, and you have made ophthalmic smartphone apps such as iGrader and 3D Atlas of Ophthalmology. Go for it. All yours, Dr. John.
Thank you, ma'am. Thank you for the kind introduction. I suppose the video will be presented from the technical side?
Yes, doctor.
Okay.
Yes, ma'am.
Sure. As they load the video, I'll just keep talking. Please play as soon as it is loaded. So smartphones have kind of taken over the world. Everybody has this supercomputer in their pocket. So that is not just the well-to-do people, even the people who can barely afford anything else, they do get a smartphone because it is a multi-purpose device. And as we have seen during COVID lockdown times, a lot of things can be done using smartphones, starting from visiting the doctor, paying our bills, and booking things, buying online, and so on.
Doctor, shall I share?
Yes, please. Yes, please.
Okay.
I would like to thank the Karnataka Ophthalmic Society for this opportunity. Special thanks to Dr. Ellen Kumaran sir and Dr. Jayasri Bhatt for moderating this session. I am going to be talking about smartphones in ophthalmic practice. I am Dr. John Davis Akkara. I am a glaucoma consultant at Sri Ramachandra Medical College, Chennai, and Western Eye Hospital, Cochin. Financial disclosures, I have made some apps and gadgets mentioned. So this is one of the smartphone portable eye clinic system, which I was talking about previously. So the typical eye clinic has this workflow: history, general examination, vision, eye exam, anterior segment exam, posterior segment exam, more advanced tests, and then lasers and surgery. For the COVID times, it is important that we have social distancing. So apps which allow video conferencing with the patient became important. Language barrier is not a problem because there are apps such as I Know Tamil and I Know Bangla which can overcome that. For a general examination, there are apps which help you to take the pulse rate, respiratory rate, check pylorictus, cyanosis, heart sounds, etc. Visual acuity can be tested using apps such as iChart Pro and the Peak Acuity app. Visual stereopsis can also be tested using the NTU RDS screening app, the random dot stereogram testing app. There are also devices using the smartphone which can test refraction, including the iNetra from MIT Media Labs and IQ, which is a copy from that. Ocular examination can be done using the smartphone, and you can do measurements using some of the apps such as Image Meter. Eye position and movements can be recorded by using eye turn for Hirschberg's test, eye tilt for abnormal head posture, 9-gaze test for the 9 gazes. And for slit examination, you can use the smartphone with a slit. This is a slit device which I had made. You can have a slit beam of light using this. For fundus examination, you can use a smartphone and a 20D with one of these smartphone adapters, such as the Trash to Treasure Redcam by Dr. Prithvi Chandrakant, or the Do-It-Yourself Redcam by Dr. Biju Raju and myself, or the Hope Scope, or the Made in India Redcam, or the Jai's Redcam. Corneal topography can be done using the mini topographer, which was devised by myself, and it can be analyzed by software made by the LBPI Center for Innovation. This is how the topography appears. Perimetry can be done using smartphone as demonstrated by us at Arvindai Hospital, Pondicherry. This is now upgraded to virtual reality perimetry now. Case sheet writing on the EMR is also done on smartphones nowadays. Crystal by Dr. Paras Mehta runs specifically on an Android smartphone, and so does so many other EMRs are accessible on smartphone. Smartphone ophthalmic photography is another major part of smartphones in ophthalmic private practice. So we need to take photographs for documentation, to monitor progress, and also for showing the patients their findings. So that will allow better cooperation and understanding of the patient. And why smartphone? Because that is the best camera which is always with you. It is portable, it allows for quick review, editing, sharing, online backup, and it is affordable. For the photography, some tips are to keep the flash and HDR and beautification mode off, touch to focus on, metering mode to be on touch, not touch to click. Zoom in, use a slit lamp light, reduce illumination comfortable for patient, and room light, preferably turn it off. Camera settings, you also have to adjust the exposure to low depending on the brightness of the slit lamp. Focus, touch the area of focus on the screen to focus to that interest area. Manual focus may be required if it is not focusing automatically. White balance, for yellow light slit lamp, it is incandescent fluorescent LED. So it automatically adjusts. You can keep it in auto. ISO, keep it low for most photos. If you are taking a low light photo, you can keep it high, but then you get a lot of grains. Shutter speed, you preferably need to have it at a higher rate because the eye keeps moving, but you might need to adjust it. Adapter or not, I usually take no adapter for just regular photographs. I use bare-handed slit lamp photography, as I call it. But you can use an adapter such as this commercially available adapter, which is around 500 to 800 rupees on Amazon. You can also use do-it-yourself adapters, which can be made out of a bottle cap stuck onto the back of your smartphone case and get excellent photographs. Slit images, you can do Van Herrick grading. You can take excellent photographs by making the slit sharp and focusing on it. You need to touch to focus on the slit and long press to lock the focus, and then reduce the brightness if required. Here you see, this is a sunken lens of a Morgantian cataract. In this, you can see the pseudo exfoliation in the inferior angle of the anterior chamber. This is a focal DMT following injury during YAG-PI. These are clearly demarcated in the smartphone photographs. For a tip, you avoid the glare from the cornea by changing the angle of the illumination, and you might have to crop out certain parts of the image. So that is how you remove the glare and other unwanted parts of the image. Adjust the exposure, contrast, saturation, highlights, and shadows. All these are available in most of the standard smartphone editing apps. but if required, you can use PixArt or Snapseed. Corneal dystrophy photography, it is, see, if you focus just like that, it might focus on the iris. But if you want the proper focusing, you might have to touch to focus on the lesions or use the manual focus. Decimal tears can be photographed, but with a slightly wider illumination, turn it to 60 degrees and rotate the beam if necessary so that the entire lesion is lit. Here only this part of the lesion is seen. You can touch to focus, long press, touch to focus, and then click. And the angle of illumination is also important. So if you adjust the illumination beam, you might see something which is hidden behind. So this is the same picture, but by adjusting the illumination, you can see the fishtail of the posterior polar cataract going into the vitreous cavity. This is a traumatic cataract. It's a partially star-shaped cataract. This is taken at an angle, and here you see this is where the glare of the illumination was. Adjust so that the glare is away from the area of interest. And this is also taken at an angle. This is an anteriorly subluxated microspherophakic lens. Specular microscopy can also be done. If you look closely, this is taken at the endothelial focus and then zoomed in. So this is a smartphone photograph. This is the maximum that I could get on my smartphone at the time. This is with a DSLR camera. If you see, this is from a friend of mine. If you see, you can see the specular image showing the hexagonal endothelial cells. Smartphone apps are another major part of smartphone ophthalmology. Lots of apps are available. I have made a few of them. These are the apps which I have made. So there are patient testing apps, ophthalmic calculators, patient education apps, ophthalmologist education reference apps, ebooks, electronic medical records, toric markers, and even a capsular access training app. The visual acuity can be tested both distance and near, contrast sensitivity, color vision, pediatric optotypes and pediatric fixation targets and duochrome tests are available. Astigmatic fan, optochondric drum, Worth photo test, all these are available. Note that we need to have the Armstrong red-green glasses to use this. The Amsler grid, the pupil gauge, torchlight exams, all can be done using a smartphone. Pupillary reactions can be recorded, nystagmus also, anti-segment, posterior segment photography as we saw, and self-refraction. I have shown you the app from MIT. So for most of the eye testing and calculations, the all-rounder app is the Eye Handbook. It is available for both Android and iPhone, and it has some additional features as shown here. All these are testing tools available in Eye Handbook app. The testing, it is still, there are some studies which show that accuracy is not as, not always there, but it has to be done. IOL calculations, toric calculations, surgical injury astigmatism calculation, and IOP correction using CCT, visual acuity conversion, all are available in the calculations part. So even the optometric calculations such as transpositions and cross cylinders are available. Visual acuity converter and the risk calculator, there is a glaucoma risk calculator. This is an app which I made called the Eye Grader, which has the grading scales to objectively document clinical findings. And it is not feasible to memorize all of them, but it will be useful to grade clinically. So this is the Eye Grader app, which is available on the Android Play Store, Google Play Store. Also, there are the language helper apps such as I Know Tamil and the I Know Bangla app. These are some of the pages in the I Know Tamil and I Know Bangla app, which allows you to take an ophthalmic history and talk to the patient about simple commands during the slit lamp examination, during surgery, post-op advice, and so on. I would like to thank all the institutes where I was trained: Jipmer, Arvind Eye Hospital, Shankar Nethralaya, Little Flower Hospital, Sri Ramchandra Medical College, and also our hospital, Western Eye Hospital. Thank you so much for this opportunity.
Thank you, Dr. John. I just saw in that list there is no engineering college, but you seem to be quite an engineer also. You only mentioned hospitals as your training centers. So where did you pick all your, give us your secret, where did you pick all the technical skills from?
Most of it is from YouTube and learning from online, ma'am. So, so I was always interested in engineering. Even my dad was the same. He was also interested in engineering. And I think one of his teachers, when he came for a consultation with him, he told him, my father is Davis John. So Davis, you should have become an engineer. Why did you become a doctor? And he said, I am an engineer of the eye.
Okay.
So that is what we are. We are engineers of the eye. We ophthalmologists do a lot of engineering. It's a complicated engineering structure.
It is a highly instrument and technology driven specialty. And with your engineering skills, I'm sure you have like, fascinated, and all our mouths have fallen open now. One question which it comes to my mind is, we are competing, like on one side, we have all these really expensive, heavy duty, high, higher end kind of instruments. And one side, you are like bringing it all down to a smartphone. Now, how much is a patient receptive? Because if it is a patient who has been to an eye hospital wherein all the huge and the international gadgets he is exposed to, and then he comes to another setting wherein all smartphone methods are used, then how do you actually, get such a patient to believe in them? Who would be the early adapters? Like if you say that now I'm a fresh MS, post-MS person, and do I go and invest into all those bigger gadgets, or do I just invest on the smartphone and the smartphone gadgets? What does it depend on? Whether, which city I practice in? And can you just throw some practical aspects?
Yes, ma'am. So this is a very, very difficult question to answer. As you said, the higher end devices are there, and patients nowadays, most of the patients who Google and read about all these things, they know all the higher end gadgets. So they will not be satisfied with the low cost gadgets. But as we are the doctors, and we should be using these instruments as our tools. We should not let these tools use us. So as far as we are comfortable and confident with these instruments, we can do some of the testing and imaging using this. For example, if I get a patient with some fundus finding or even an anterior segment finding, I immediately take a smartphone photograph and show it to them. And sometimes I even give the photograph to them. And once you do that, the patient rapport, it goes up immediately. So then the patient knows that this is what we are treating. The doctor really cares about treating this thing, and they are absolutely convinced and will follow your suggestions and your treatment protocol. And then if you say, okay, this is an initial thing, we will need to do, say, an OCT to look at it in detail, or we need to take a stereo fundus photograph later. They do agree. So in that sense,
so most of these are like these are for screening, and these are for documentation. And these documentation. However, based on this, we cannot, as a basis, keeping this as the basis, can we even institute treatment? Like you put in one question mark that some of these IOL calculators or something, they might not be precise. So do you really rely on them to do your surgeries, or is it like for one gross understanding, and then you will still go back to some of the standardized instruments before you institute treatment?
So for measurements, so for example, axial length and keratometry, we would go for still the standard instruments. But if you want to do an IOL calculation, say using the Barrett formula, there are these apps which definitely use the original Barrett formula. And if you look, the latest updated Barrett formula, or even the Hill RBF artificial intelligence formula, they are not available on our most expensive equipment. It has to be done online, and these are available directly on the apps. There are some of these things which are still the standard of care on the low-cost smartphone end spectrum, whereas some of the devices such as the axial length measurement, keratometry, OCTs, fluorescent angiography will still require the more expensive gadgets.
I have a question for you.
Anyone ask?
You mentioned adapters. Are you choosing
Yes,
adapters from the market or you make your own adapters? Post for the fundus examination and slit lamp. You showed me a slit also, how to adjust the light and all that. That's what I want to know, whether it's picked up on the market or you make your own adapters.
So the slit, I made it myself, and me and a friend of mine, we made a smartphone fundus photography adapter. And the slit lamp adapter, I just found it cost effective to use the 500 rupees adapter, which is available on Amazon. So it is a combination of both, ma'am. I do make some of these gadgets and I do use some commercially available adapter. In fact, I use the adapter which was not made for microscope, which was made for bird photography on a binoculars. So I just repurposed that to use on slit lamp microscopes and modified that to take fundus photographs. So all these are modified things, and many of them are being made by us.
The adapters, what I saw was there was dilated. The eye was dilated, both for the anterior segment. You had dilated the eye and shown. But actually, in a remote consultation, if patient is only there on the other side, dilatation might not be feasible.
Yes, ma'am. So photography for a home consultation is not really feasible right now. Undilated fundus photography using smartphones will need more complicated equipment. You'll need a coaxial illumination. So this is not feasible for a home teleconsultation. It's only if in your private practice you don't have a proper fundus camera yet. You are just a beginner, fresh out of MS, and thinking whether you should buy this fundus camera immediately or not. You can make do with this for the time being.
Now the thing is, many optometry, where teleoptometry is coming up. So where other spectacle shops, their optometrists are coming. Maybe they come for only a refractive error. They take the photographs, anterior and posterior segment photograph, and try to image. They find some pathology. For the optometrists, will it be easy for them to do with the adapters?
Depends on how comfortable they are with using the slit lamp. So the smartphone slit lamp adapter, which I use, we can easily take good smartphone videos of the anterior segment and also the posterior segment, even undilated, if you are very comfortable using the 90D or 78D lens to see the fundus. In fact, whenever I have a glaucoma suspect coming in, somebody whom I know, I immediately take an undilated photograph for them on their smartphone and tell them, okay, this is the fundus photograph of the optic disc as of now. When you can, you take a fundus photograph, OCT and HFA, and keep this as your baseline. So I do take undilated photographs with that. If the optometrist is comfortable using a slit lamp and 90D, 78D, they can also do the same.
Thank you.
Thank you, Dr. John. With that, we go to our next presenter.
Vineet had something to say.
Vineet?
Yeah, hi.
Yeah.
Great presentation, John. Good morning. To just answer to Dr. Sheila's question, we have a team in place which can customize any design for an adapter for any microscope, surgical as well as OPD microscopes. So we do that on day-to-day basis. We have 3D printers in place, so we have a team. Whoever has any kind of requirement, we kind of customize it and make it in a day and start using it. So that's pretty much doable. If you have any need, you can always let us know.
That's super. That's very, very wonderful use of 3D printing and designing. Thanks,
So
Dr.
collaborations are happening right here in this session.
I actually came for a 1-week workshop in L.V. Prasad Eye Institute, engineering the eye workshop.
Yes. We'll
Next
have
time
it this
you
year.
have one, Dr. Vineet, one more aspiring candidate is here. Next time.
Oh, Dr. John could be a mentor in this session. He is far more experienced than than all of us here.
If you ask me about my engineering training, that is probably one informal engineering training which I had.
All right.
Yes. So, and to that, even the Gravi we are going through internal audit currently to see the quality of imaging. Soon we will bring it out for everyone as well. So yes, I'll keep updated.
Thank you, Dr. Vineet. Thanks again, Dr. John. So we actually have Dr. Jaitra's presentation next, but Dr. Jaitra is physically not here with us today. We will play his presentation a little later. We could have Dr. Karishma's talk now. She's going to speak about digital marketing, do it yourself on Facebook, Google, and WhatsApp for the private practitioner. Dr. Karishma is the medical director and chief surgeon at Jehan Eye Clinic, Vilepale, Mumbai. She's a cataract, cornea, and refractive surgeon, adopting advanced technology IOLs like multifocals, trifocals, toric in her regular practice. She has several paper publications in multiple journals and has presented papers and delivered talks at various national and international conferences. She's an alumnus of Narayan Netralaya, if I'm not wrong, Dr. Karishma. So, yeah, stage is yours, Dr. Karishma. Please go ahead and present yourself.
Thank you for that lovely introduction. I would like to thank the organizing team at KOS for inviting me. Like Dr. Praveen also mentioned, it brings back a lot of good memories. When I was a fellow back then in Narayan Netralaya, I had presented in KOS and got the prize for the best paper of that session. So fond memories coming up. And today I'm going to be talking about something that's relatively, or rather not clinical at all. And it's something to do with an upcoming area of buzz, which is digital marketing, doing it yourself. The reason I'm specifying doing it yourself is because there's always agencies who can do it for you, and that becomes paid marketing and paid promotions. But I'm just talking about what you can do sitting at home by yourself. So let's begin. So why is digital marketing important? I think it's the next go-to thing, because of the fact that especially if you are a fresher who's just come out of your fellowship and now you're stepping into clinical practice, where you are surrounded by people who are, well-established practitioners or institutes or hospitals, then you want to stand out in the crowd. You want somebody to notice you. And this is the easiest, most cost-effective way that unknown people will get to know you. We cannot overlook the fact that word of mouth is most important, but how will you build that word of mouth? First, you need someone to step into your clinic and get a consult with you. So in order to do that, you can increase your reach by using digital platforms. So there are different types of marketing. There's digital, there's physical, and then there's social, of course. In digital, again, there is organic and paid. So organic digital marketing is what I'm going to be talking about. You make your own reach increase without paying any website or any app. Then there's a physical marketing, which has always been done the conventional way since so many years, with posters, handouts, pamphlets, so on and so forth. And then there's a social aspect to it. So there's camps which most of us are familiar with, and indirectly through social service, like if you're affiliated with, say, a Rotary Club or a Lions Club, where you're going to do social service with them, but you are your own PRO and you promote yourself and what you do, and that's how you get more and more connect. So why digital marketing? Because like a lot of the previous speakers have also covered, most of our patients are online. They're always searching for something. The younger generation is going to be on their phone most of the time. So these are your target audiences, especially if you are, for example, a LASIK surgeon. You want to be speaking to the public who is of the younger age group, and most of them are always glued to their phone anyways, aren't they? It's cost effective because you're doing everything yourself, or at least that's what I'm talking about. The engagement and interaction is something that is got an upper hand over a physical handout. When there's a physical handout, for example, you put it into a newspaper and you've circulated it in your surrounding area, for example, but you don't know whether the opposite person has received it, whether the person has seen it or just thrown it into the bin, and so you don't know what's going to happen. But in an online platform, you have an engagement with your audience, there's comments, you are interacting with them, so the audience comes to know you as well as you get to know what the people have on their mind. This also helps create your online reputation so that your own name on, say, a platform like Google will go up the ladder if you have more and more online visibility on other platforms. And then, of course, you can be a leader with your own thoughts and your own blogs. There are a lot of people who are now resorting to that, writing what they think, whatever it may be. They may be talking about photography, they may be talking about, travelogues, and talking about something apart from medicine, which attracts the opposite person's attention much more. So there are a lot of digital marketing strategies, and this can get a little overwhelming. But the main point that you need to know is that you may or may not be able to do everything, but you need to do at least something. So start somewhere. Don't get overwhelmed. Keep realistic targets. There is a lot of things that can be done. There can be email marketing, there can be WhatsApp marketing, there can be social media, there can be Google. You can't do everything. So try to start somewhere, which is why I'll also be talking about Facebook and Instagram, because it's the easiest thing that you can do just by yourself without anybody helping you. So first and foremost, what do you need to do? You need to create a brand for yourself. Know thyself. This is very important because we are going to move to the first and the most essential part of digital marketing, which is setting up a website. It is extremely essential that everyone who is venturing out into practice, especially in their nascent stage, should have a well-made website. And for the website, you need the following steps that I'm going to be discussing. So what is your USP? What are your pillars of branding? Who are you marketing? Is it you yourself? Are you talking about you? Like, am I talking about Dr. Karishma? Or am I talking about my clinic, which is Jihana Clinic? Who are you promoting? What are you talking about? And get a good logo and a tagline designed along with it. This is very important because most companies, if you go forward and see, they have a vision statement. My own alma mater, Narayan Nethralaya, has a very short punchline. It says, your faith shall heal you. I think it's a very short, perfect, appropriate statement, and it carries a long message, goes a long way. So have a vision statement, have a mission or a purpose, and a value or a belief system for which you have short punchlines written down. Where does this go? All this goes on your website. Why does this go on your website? Because when people see you on social media, whether it's Facebook or Instagram, you want to generate curiosity in them to go and try to find out more about you. And where will they get more information about you? On your website, in the About Us section. So in the About Us section, you write about yourself, what is your vision, what is your mission, so on and so forth. Ultimately, all networking platforms will lead to only one thing. You want them to ultimately go onto your website. Why? Because on your website, you're going to have the option that, okay, if you want to reach out to me or you want to connect with me, call on XYZ number or email me on XYZ address. So it has to be all interconnected. So once you build a brand, there's multiple steps to it, but posts on social media, as you can see, is just the tail of it. It's just the bottom of it. You need to do everything else before you get started. It's very important when you're doing this to also know others. You need to have an idea of your demography and the geographical targeting that you're doing. If you are talking about cataract to an audience or a population who is between the age group of say 18 to 25, it may not interest them at all. But if your target population or the population you are speaking to is say between 35 to 45 years age group, these are good candidates. Even though they're not themselves going to undergo cataract, they are the population who will be looking for a cataract surgeon for their parents. So you have to know who your posts are directed to, who are you posting for, what are you posting for, what is the target of you going on social media in the first place. So you also need to know your keywords and your categories. Now, ads will amplify whatever you post on whatever platform, whether it is Google, whether it is social media like Facebook or Instagram. After every post, it will give you an option. Would you like to promote this post? So you can always do that. You can always pay and promote. You can promote one particular post if you think it's getting more popularity. You can do whatever works for you. But we are right now covering pure organic growth. So for that, like I said, rule number one, website has to be perfect. You have to have good quality photos on your website. It has to be updated from time to time. You can't have a website which you made 10 years back and still use the same thing. It has to be regularly updated because Google is watching, and that's how it's going to promote your website. Randomly, no one is going to search for Dr. Karishma Wadia. Someone is going to search for eye surgeon near me or eye specialist near me. So these keywords need to be incorporated into your website along with your posts, which I'll be covering. You need to blog. A blog is just a short article for any relevant topic, like for example, what is cataract, which maybe you can attach a photo along with it. There's also videos. You need to have videos because that's the best way of communicating to anyone. Audiovisual is always going to capture more attention than anything else. Your posts need to be attractive, and your website has to be mobile optimized. Now, this is something that is a complete must because, like one of the previous speakers mentioned as well, everyone is searching for you on their phone. No one is going to go onto their laptop and go search for eye specialist near me. So your website, when it opens up on somebody's phone, it should be mobile optimized so that it doesn't break up or crack up or half data comes. It should be clearly visible and user friendly. Once you have got your website set right, then you go on to the next step. Step 2 is any platform of your choice, any one or multiple or all, as much as you can do, as much time as you have, as much budget as you have, there's no limit. So you can be on Instagram, you can be on Practo or Just Dial, you can be on Quora. Why should you be on Quora? Nothing. You'll be answering questions which any random layman are asking. And ultimately, when they come to know that, oh, this is a doctor who's answering me, then, like I said, again, it's going to create curiosity for them to go onto your website, check out who you are, and that will convert into an inquiry. Okay, can I come in for an appointment? And then you possibly may have a walk-in. LinkedIn is also being used a lot of late. And of course, there's Google Ads, which has always been there. Let's start with my favorite or my easiest way to tackle with digital marketing, social media, hashtag like a boss. Why hashtag like a boss? Because there has to be a punchline hashtag for everything you do. If you don't, then your message is not going to carry that much weight. And why is Facebook and Instagram put here next to each other? Because the easiest thing you can do for yourself is link the accounts. You have an option to link your Facebook account along with your Instagram account. So this makes your job half. You don't have to go separately on Facebook and separately on Instagram. You just make one post and post it on either one of the platforms, and it also gets posted to the other platform by default because you've changed your settings accordingly. Now, this is my Facebook profile. Okay, you need to have a good photo of yourself. You need to have a good background photo. So the photo conveys that I'm a doctor. So on first impression is that, oh, she's a doctor. It should not be a random photo of yourself standing against a mountain or a river. You can do that. That could be your personal profile. And this is my personal opinion. I like to keep my personal account different from my professional account. So I don't share anything very personal on my work related account because that's me. But there are a lot of people, especially social media influencers, who feel that no, you need to incorporate your personal life into it so that it doesn't become monotonous, and patients tend to get overwhelmed with just medical knowledge, and they start getting scared or psyched out or afraid. So you need to have a little tinge of personal life to break the monotony. That's your personal choice. You get to decide whatever you want to do on your own profile. All right. It's very important to set up what is called a Facebook page. So when you have a Facebook account, the reach of the account is predominantly only to the people who are on your friend list. It's not randomly going to send your post to unknown people. But when you have a Facebook page, then your page can be seen by anyone. And that's what you want. You don't want to be known by the people who already know you, who are already your friends list. You want to be known more and more by unknown people. Why? Because that's what's going to get you more and more clientele. They need to know who you are and what work you do. You also need to have your Instagram profile sorted. Again, try to keep the same display picture so that the patients identify with you across platforms, whether it's Facebook or Instagram. And there is this section down here called highlight section. On the bottom, all these circles that you see. So this should be the most important categories that you have segregated your work into. So for example, I have segregated it into featured, wherever I've been featured, or conferences that I've spoken at, and then different parts of the ad. How does social media help you? So this is a reel section that comes in Instagram, which is very short videos of maybe half a minute to a minute. You get options of as long as you want them to be made, and you add trending music into the background. And it may just be anything informative. It may be, for example, I have made this reel on myth busting, carrot juice, and spectacle numbers. And I got 60,000 views on that reel without realizing, without doing anything, without paying anyone. And that one reel which gains popularity pushes the promotion automatically by their own internal algorithm of your other posts. So again, like I said, more and more people get visibility, and then they reach out to you. So they'll possibly send me a text on Instagram saying, "Ma'am, I have eye pain. What can I do?" So then it's up to you how you redirect them to your own clinic. So then you can say that, okay, I would be available for an online consultation, or if you would like, you can step into the clinic for a physical consult. That's how you will convert the patient to be yours. So like I said, Instagram, the world is your platter. You decide what you want to post on. This is Dr. Rupa Wong, who I follow on Instagram. She's an ophthalmologist based in Hawaii. She talks on everything. She talks on fashion. She talks on her recipes. She talks about her kids and where she left them because she had to come for work. She talks about what exercises she did. She talks about everything. So you choose what you want to talk about, and you can still gain popularity anyways. People need to ultimately know who you are. So get your message out there. So when you want to post on Facebook or Insta, like I said, link the two accounts, but be consistent. You can't post today and then post after 1.5 months. Everyone is going to have forgotten who you are and where you came from. Ideally, you can make a pattern in your grid. So this is all things that are done by social media managers, which I think is a little overwhelming for people like us. But if you can do it, and if you have a creative streak, then by all means, you must go ahead. Ideally, I think you would want to post 2 to 3 times a week so that it doesn't become too much and too overwhelming for the opposite person. And what do you post will you can come to know in insights. So insights is a feature in your Facebook or Instagram. After your post is put up, you go into insights and you get to see who saw your post, what was the age group that saw your post, which part of the country was it, in your locality, was it people abroad, what time of the day were they browsing. So accordingly, that time of the day you may want to post, so on and so forth. And ultimately, it boils down to creating and posting content that drives user engagement. So it's not just text. You can't just type a post or a well-written text. There has to be a good capturing image with it. For that, I highly recommend getting some sort of slit lamp photography, like we discussed in the previous talk. No financial interests. I use the slit lamp adapter designed by Dr. Jaitra himself. And I would like to thank Dr. Jaitra and Dr. Ellen Kumar for giving me this talk. But Dr. Jaitra, special thanks, because his adapter helped me or helps me take excellent photographs on my smartphone. And those photographs are what I put up on my social media. So it has helped me phenomenally. So, like I already mentioned, there's a whole world of social media. There's so many things to do. There's Facebook, there's Instagram, there's Pinterest, there's LinkedIn. There's so many things. You decide what you can do. You decide if you can do all. You decide if you don't want to do anything and you want to allot it to somebody else by paying them. The world is, the sky is the limit. Always start with a plan. See who's your target audience, what message you are sending, where would they be hanging out. So if it's a younger population that you're targeting, if you're a refractive surgeon and you're looking at a younger population, they are going to be on Facebook and Instagram. But if it's a slightly older population, they will possibly be on Google. They will be searching eye doctor near me, or they will be maybe on YouTube trying to see an animated video of what is a cataract. So post accordingly across those platforms. Your business type should inform what you are doing. For example, this is a post that I've picked up from Instagram. When you see this, it's a beautiful landscape, it's beautiful mountains and a sky. This is the display image of a company that produces photographic equipment for landscapes. So this is their photo which conveys their message with their product. Okay, they're going to ensure that you get excellent landscape photographs. So how does it help meet your marketing goals? Ultimately, like I said, point number 1, everything has to be directed to your website. So you first make your website. Without that, don't start. increase your website traffic. This will help you build conversions because they will ultimately call your clinic. Again, you need to make sure that the person answering the calls is somebody responsive, is somebody who can address basic inquiries and convince them that yes, you just come to the clinic and the doctor will take a look at you, or why don't you schedule an online consult with us? So your receptionist is very important to convert that call or that inquiry into a walk-in. Of course, it helps create awareness and build your own brand identity. And like I already mentioned, it improves your communication and interaction with the audience, particularly in COVID, because we've always have masks on our face. A lot of our patients come into the clinic, they've not seen my face through the consult. So they go, while they are in the waiting room, they go onto Facebook or Insta, search for me to see what I look like. So it's important because of COVID, we have masks, we have lost that face-to-face interaction, and we can't sit and remove our masks over there. So at least you should have some visibility on some platform. Like I said, the ideal strategy is a combination of multiple things. Maybe you can do them, maybe you can't. Make sure that your social media content is planned well. I've posted over here something that one of my colleagues, Dr. Samresh's hospital, Dr. Raghudeep Eye Hospital, has posted. It's a catchy photo. It's something that typically would be posted on Valentine's Day. And it's a very subtle message. Take care of the eye of your loved one. Now, it's not called, this is indirect marketing. This is not direct in your face, come to the clinic and one pay, one free. This is not you saying, okay, if you come on Valentine's Day with your wife, then I'll give your wife the free checkup. This is very subtle and indirect. It reminds the person who's watching it on Facebook that, oh yeah, my mom was complaining of some eye pain and I needed to take her to the eye doctor. I should take her to the eye doctor. So this is indirect marketing. That's what you want to do. You want to very subtly tell them, maybe there's someone who needs an eye checkup and maybe you need to get them to us. So that's how you would convert these patients. You need to regularly update these profiles by posting on current pertinent topics. This is my friend again, Dr. Samita, her post. So if you see the image, it's very capturing. It's just one thing. It's coronavirus. There's no random riffraff. And the message next to it is very pertinent. Avoid touching your face, avoid sharing phones, napkins, holding railings in public places. It's just a short punchline. The audience has to remember who you are and that you post to relevant topics, not random things. So make sure that you're getting your
sorry
message.
to interrupt. Doctor, sorry to interrupt. 17 minutes you've spoken.
Yeah, so I'm almost done.
Thank you. Thank you.
So you need to regularly blog as well. It's very important to have a Google My Business profile. This is something that again should be done along with your own website. Put up photos of your clinic as well as yourself and make sure that everyone gives you a review. This is just an example to show somebody, some other profile who did not have any reviews, and just one review, one bad review is the only thing that pops up now when they are searched on Google. So even though a second person, if you see over here, there's just 2 reviews, even though a second person has given a defensive review saying that no, one of the finest doctors, when you search on Google, it will always show you this bad review. So make sure that you are also doing an analysis. This is my own profile. Somebody had put a 2-star review. So I went back to find out what went wrong. And I realized this patient has never come to the clinic. So then we found out that this is a patient who had called up but did not come for the appointment because he could not match his timing to our consulting hours. But they went on to Google and gave a negative review. So I've replied so that the public knows that, oh, you've never come to us. The public should know what is happening. You should respond to all reviews. Of course, there's LinkedIn. Don't forget your hashtags. It should be short and memorable. And that's what's catchy on any Facebook or Instagram profile. These hashtags that I had put on a post of prosthetic contact lens generated so much inquiries that they were like, oh, my maid's husband has a white eye. I didn't know this could be possible. And that's how, they ended up sending me somebody more. And lastly, there's YouTube and WhatsApp. You can just record yourself again with this lovely smartphone, okay, on selfie mode. So that's what I did during the lockdown. I created general information videos. I work a lot with keratoconus patients, so I created a lot of keratoconus videos. It reduces your chair time with the patient. So when the patient is with you, you just tell them, yes, to know more while you're sitting in the waiting room, why don't you go through YouTube and see the videos that I've made. And what do you do for WhatsApp? You take the same video and you share it on WhatsApp. So in peak lockdown, when we were all sitting home and couldn't go to the clinic in the initial phase, the initial lockdown, we were making these videos and sending it to the WhatsApp contacts that we have, so that again the patient remembers that, oh, if I have redness, I'm in peak lockdown, I don't know what to do, but oh yes, this doctor is available for online consultation. So ultimately everything is driven towards curiosity to call you and then convert into a patient. But beware, don't randomly jump on the bandwagon, do a proper analysis and then start. Be consistent, otherwise, don't do anything at all. This is not a standalone tool. If your communication skills are not good, if your clinical skills are not good, does not matter how famous you are on social media, the patient won't be yours. So, thank you very much. Hashtag gratitude, since we're on hashtags right now. Thank you very much.
Thank you, Dr. Karishma. That was like, I really enjoyed your complete talk, your session, and it is so important for all, especially for private practitioners, non-institution based private practitioners. This is so much like online word of mouth is what that we are, counting on these days, and some very smart moves like chair time when they're waiting for you. That time that will also increase your number of subscribers. Like,
yes, it also increases your views and your subscribers.
Yeah. So while
indirect, everything is indirect.
Yeah, indirectly. Digital eye strain is like such a common thing. Every second person visiting you has, or even the first person in a general practice like mine, especially like we have to talk about digital eye strain. So that is my go-to. I say, go on YouTube. I have a 7-minute video on digital eye strain, and why don't you just have a look at it? And that's how I could relate with so many things that you're saying. Is there anyone who wants to ask Dr. Karishma the doubts? Dr. Saravana?
Wonderful talk, Dr. Karishma. I agree with all the points that you have mentioned, and so this is the next generation. All the people they will look you up on Instagram, Facebook, Google, everything before coming to you. So, in fact, they will know more about you than maybe even about you. So
a lot of them, especially from IT backgrounds, Bangalore, everyone is on their phone. They'll first check out who you are and then they'll come to you. And most of them will even tell you when they enter. And if you ask them that, who gave you my reference, they will tell you that, yeah, actually we saw some post of yours about dry eyes, and that's how we decided to come and visit you. Because then they would have gone to your website, seen your qualifications. So that's why I said website is your main landing page. Make sure that everything, all your certificates, don't put them up in the clinic, put them on your website instead. So first get your online presence right, because that is especially important for newbies, beginners like us, where we want the world to know us.
I think Karishma, was a wonderful talk. I think answering all the reviews, I think that's very, very important. Probably, I think as your practicing is increasing and everything, probably a designated person who will definitely answer them within the time period every day is also probably very, very important. Both addressing both negative as well as positive. Yes, that is very, very crucial.
And that one observation which I've made in my case is I used to be very high, on my personal post, but would hardly, because it is about patient confidentiality, and when it is a professional presentation, you just cannot just randomly put something. It has to be, curated content and all. When it comes to personal posts, I'm not such a perfectionist, but when it comes to professional posts, I said, oh no, we have to do it in a certain way. We have to do it in a very professional way, and that used to never happen. So overall, people I got overexposed on my personal side, but then the professional aspect hasn't been. So now I'm trying to rectify it. That mostly 80-90% of the times we have to be portraying our professional self, and in between, if you go on a holiday, so then people feel that, okay, ye doctor holiday bhi jate hain. It's not like, this doctor is holidaying all the time and sometimes sees patient. This actually worked. In fact, my colleagues are asking me, do you even practice? It's only that, you are going out with friends and you're doing workouts, etc. Are you even practicing? I said, this is not something which I've been highlighting. I better do it. People think that I'm doing nothing in life in terms of profession and practice.
No, and we tend to get overwhelmed by the bigger posts, the bigger institutes or anything, because they have well-designed social media planners. So they have some fancy post popping up. So we think, oh, we'll do this later and then we'll post. There is no later. You click the photo and you post it. Nobody cares. They just want to see you doing some work, some eye surgery. Now, yesterday I've gone for a visiting consult to Pune, where I went to a hospital over there and saw whatever patients. We took photos. We put up one photo while in OPD, one photo while in OT. Already, we've gotten some queries saying, oh, there's a cornea specialist coming to the clinic. We would also like to come. So just create that curiosity.
So on the go, you have to be, and consistency is one thing very rightly put. That if you do something, do it on a consistent basis, otherwise not do it at all. This is another, learning for me, take home that I'm going to take from your talk. One more thing is that LinkedIn versus this. So LinkedIn is, I think, mainly where you connect with other professionals. So it is more of a B2B kind of a thing, wherein the Instagram or the FB is more where you directly connect with your customers, clients, or patients, as we would call them. So that's one. Another observation I'd like to make here is you versus your clinic, like how much of personal branding and how much of clinic branding. In the beginning, I think it just goes very parallelly. You are trying to build yourself as, and then, your clinic is nothing but a reflection of you. It just goes on, probably, I don't know for how many years or so, and somewhere it spirals, and then, your brand becomes much bigger than you. And that's the whole idea, where we would want our enterprises to become and our projects to become much more bigger than us. So thank you, Dr. Karishma. Wonderful talk.
One more question, ma'am. Did you have any pattern on how you go viral? You showed one of your reels which went 60,000 views.
So I have a sense of I add a tinge of humor to my posts. So this particular post this particular reel is actually one of my favorites, because it's just showing me in that expression when the patient says, oh, if I drink Karen juice, will my spectacle number reduce? And my face goes like that, huh? So this is what I'm actually, and I've said on the side, this is what I'm actually thinking when the patient says this. So I've not done anything intentional. It's just my true emotions, which I have, posted. And a lot of people in the older generation feel that, oh, we can't do all this Facebook and Instagram and all. But in fact, the lockdown, I have seen a lot of general practitioners in my area who became so active, not maybe on Facebook or on Insta, but like I said, you just record a video and you circulate it on WhatsApp. So it goes on so many videos. Just, what vaccine should I take? What booster vaccine should I take? That itself makes us aware that, oh, this doctor is here. And, they have a paper written on the side, which, because they don't know how to edit the video. So they just have a paper on the side which says, which COVID vaccine should I take? So it's as simple as that, but you just need to make that start and go for it. It can be anything, like I said, it can be WhatsApp, it can be Facebook, it can be Instagram, whatever floats your boat, but get out there.
Do you have a call to action button on all your Facebook page as well as your Instagram? Book your appointment now. Do you have that on your?
So I don't have a book my appointment option, because for that there's a lot of you have to link your Instagram to something else, and it's a little complicated. So instead, what I do is in the post I write that if you want to reach out to me, send me a direct message or call us on XYZ number. Or at the end, it has to be, for more details, you can, visit my website, or there can be a link that you can add of your own website. In the post, you can just click on this link to see more about dry eyes on my website. You can attach more links to it. But there is an option of putting call to action. I have not activated that yet. And usually every post that you put, you will get a couple of direct messages immediately. Oh, ma'am, I am getting, I've posted about some redness in the eye, subconjunctival hemorrhage. So I've not even taken a slit lamp photo. I've just taken a photo like that only, gross photo, and put it up. That, often people get scared or overwhelmed by these bright red eyes. And this is what it could be. And very rarely it could also be ABC. Do you know someone who has this? Again, you have to generate that curiosity. Do you know someone who has this, or have you had this experience in the past? So what that does is they also will comment. Some of them will comment saying, yes, ma'am, I had this, or something, something like that. That again, their internal algorithm of Instagram will see how many comments you got, how many likes you got. So they'll again push that post to more unknown people. So generate curiosity.
I will tell you why I started. This is like something really deep. One of the patients that came to the clinic, I take a lot of time counseling and explaining the problem to the patients. He said, ma'am, why don't you just go online and do all this? The last word he said when he left the clinic was, the wrong people make all the noise because the right people are keeping silent. So then if we have the experience, the knowledge, and the kind of, content which is genuine, then we should be the ones who are like going all out there and letting the people know. Earlier we would have health awareness talks, earlier we would have camps, but those are all become much less now. So this is our platform wherein we can talk about preventive care, or what the patient has to do as a first aid, and general things and specific things pertaining to our practice. And the more we do it, then we can silence the people who are giving wrong information, non-medical people who are giving wrong information there, because there is no entry barrier. Anyone can go and talk. So more and more of us have to take to such platforms. Thank you for the motivation, encouragement, and I'll follow you from now onwards. Subscribe, follow, and subscribe.
Subscribe, follow.
Follow.
Thank you
We'll
so
move
much.
on to our next talk by Dr. Saravana.
Yeah.
We will keep Dr. Jaitras to the last. Dr. Saravana, I am introducing, are you here, sir? All. Dr. Saravana is a very senior doctor here amidst us today. He is MD from All India Institute of Medical Sciences. He has worked in Victoria Hospital. He has worked in as a vitreoretina person in RP Center. He's been in All India Institute of Medical Sciences. He's also been in Cochin. He's had a stint in Cochin. He is presented in several symposia and seminars. He is currently consultant in ophthalmology and vitreoretina at Sri Venkateshwara Netralaya, Bangalore, which is an advanced center for treatment of eye diseases. He has got his pursuit in clinical, academic, and research activities. He's also the first surgeon in Karnataka, India, to implant a Carl Zeiss multifocal IOL when it was launched as early as 2006. He is a technology enthusiast. He was into anterior segment and surgical imaging, video overlays, subretinal instrumentation, etc. Thank you, sir, for being here with us today and your presentation on optimizing EMR and HIS in improving ophthalmic practice. Sir, the stage is yours. Please go ahead.
Thank you, Dr. Jayashree, for that wonderful introduction. I'm just going to share my screen. So, can you all see my screen?
Yes, sir.
So, I am Dr. Saravana Kodandapani from Bangalore. So, this topic was given to me by Dr. Ellen, optimizing EMR solutions, because we are ourselves in the process of actually creating an EMR called as iSoft. So, I have been using EMR solutions from the time I started practice, that is since 2004. So I have had various versions of different EMRs, and this talk is primarily going to focus on non-medical aspects of optimizing your EMR. So we all have heard a lot of things about medical aspects, but how can we use non-medical aspects to improve our practice? So as I said before, I have one financial disclosure. So I'm a consultant to iSoft India Limited. So and I have no other disclosures. Traditionally, EMRs were basically storage and retrieval systems of medical data. So then they added a search function, a global search function, where you can just put in a keyword or a root word and then get all the related data that you have already stored. So it usually contained demographic data. When you come to just non-medical aspects, it just contained demographic data. And your multimedia data, that is your images, your videos, and things like that. So mostly it was server based. Your hospital had to have a server. Then it migrated to the cloud, so that if you have different centers, you could have a common EMR solution, and then that should make sure that you are able to access your own data from anywhere you want. Now then you could also get reports and summarize data. For example, if you wanted to know how many new patients you saw in a particular month or a year, or day wise, then you could get that data, how many glaucoma patients you saw, how many ARMD patients you saw. So this kind of summarized data was also provided. certain degree of basic analysis was possible. For example, if you wanted to know in your practice what are the top 5 earners, LASIK, cataract, ARMD, anti-VEGF injections, so you could get that based on the revenue, and comparisons of revenue among the various procedures, and even among various doctors, among the referral sources. Some amount of pie charting and bar diagrams were also possible. Now, the current trends in the changes that have come in the digital era have made our needs totally different. So, it's not just a matter of just having an EMR for just storage and retrieval or seeing reports. So, it should help us in seeing more patients, because most of your patients are actually sitting in front of laptops or mobile devices or tablets, and actually spending a bulk of their time in front of devices. So you have to have devise a way in which your EMR should be able to connect to them and then get them to access you or your services. You have to engage them and stay connected with them. So, for example, as the previous speakers have told, you have to be constantly on the move. You have to reply to their questions, reply to the reviews, thank them for their reviews, and then troubleshoot if they have any bad experiences. So you have to be staying connected with them, and if you can automate a lot of these processes, there's nothing like it. So you also have to save time. When you automate all these processes, you save not just time, but you also save a lot of manpower. And many of the time when you automate it, you are doing the right, the things in the right way. Whereas when you actually employ manpower, sometimes they make spelling mistakes, they make grammatical errors. So a lot of other things are also minimized when you actually automate. So, and time is money. So if you're left with more time to see patients, if you're left with more time for yourself, there is nothing like it. And the other thing is, it also enhances patient experiences. So if a patient can directly access the EMR system through a link or a user ID password, and then see his profile, see his access his reports, and then download them at a later date or at any date when he wants. So these are things like, or even the bills. For example, sometimes he may have lost the bills, and if he can access those bills and download them. So these are things that actually enhance patient experiences and retains them into your practice, so that he knows that when he comes to you, he is not paying for that particular consultation. He is paying for a system that is going to provide him after consultation services also. You also have to have the system which will smoothen the workflow, both online and offline. So traditionally, online, if you say when he makes the first contact with you, so from that point onwards, you can have a chatbot. So wherein it gives you then the commonly or frequently accessed services. So they can download using the chatbot certain brochures, the counseling material, videos. So if that process can be automated, that will actually help in smoothing the workflow and actually making the entire patient experiences automated. So the offline experiences, once they access you online, so at some point of time they would make the decision to come to you offline. That is, they actually make the hospital visit and then they come to you. So it helps if you can if you have already stored their data. For almost 50% of the work is over. So if you have a data where they have already fed in their problems online, they have fed in the demographic data, everything. So you don't have to spend time in registration. They spend minimum time in the waiting, and a lot of things actually enhance the patient experiences when you actually smoothen the workflow. Then you also, as the previous speakers have already told, we have better analytical tools nowadays. It's just not the basic tools. So you have tools wherein you can see what was the response of the patient population to a particular marketing campaign. So if you have had a marketing campaign, then when the patients come in, are they responding to your pamphlets? Are they responding to your brochures? Are they responding to the radio jingles? Are they being referred through the traditional sources? So if you can analyze these data individually, then you will know what is working and what is not. The next thing that we need to do when we want to see more patients is we need to the EMR solutions to be linked to online platforms so that this online listings with user friendly patient interface, they not just capture your data, so your data and the patient's data, and keep it to themselves. So the data must be primarily linked to your EMR, so that you are mirroring the data to the online platforms. So tomorrow, if there is a problem between you and the platform, then at least you make sure that the data is with you, because at the end of the day, you are legally responsible for the interaction. The platform is not legally responsible for the interaction. So we have to keep this in mind, and when we make sure that we are linking our EMRs to the platform, we make sure that the data is first transferred to your EMR system and not first to the platform. Second is, more patients from your outside drainage area can be seen through this integration of this EMR with these teleconsultation modules. So we are not depending just on our own drainage areas. In Bangalore, hospitals get patients from Africa, from Middle East. So it should help in actually making sure that they are able to schedule their consultations, the teleconsultations, and then they are actually be able to see the doctors and everything. So the other thing that you can also do is integrate your EMR into these corporate panels. For example, if you are impaneled in BHEL or BML or other ISRO and public sector undertakings, you should make sure that you're there on their homepage. For example, their employees should just be able to go to their home pages, which they're more used to, the navigation, the design of their home page. So they're more used to, and if you're there on their panels, then it is very easy to actually for access your services by just clicking a link on their homepage. So for their own employees to schedule their tele appointments, you should be able to integrate your AMR with their own systems. So the next thing is, we already have this SMS integration for staying connected with them. But as you know, SMS and email nowadays, no one sees or sees them except for their OTP, for their banking needs. So any other message that is just lost. So you can even bury a dead body there and no one will find out. The new kid on the block is WhatsApp. So patients are now very much deeply integrated with WhatsApp. So if you can link your EMR systems with WhatsApp and then through an APK, and then send all the messages, save their contacts, everything, then that would be the best sort of an engagement tool, wherein you can send your own videos, you can own Facebook page links for them to like, Google reviews, you can ask them to do a Google reviews, you can even send online polls. For example, after their consultation is over, if they can just tell us the name of the best employee in the organization. So these kind of interactions is now very much possible on WhatsApp, and that will actually give them make them feel reassured that someone is actually there to look at this data and then take remedial measures if they have any grievances. So they are less likely to even go online and then write bad reviews about you if you are already taking an patient experience poll on WhatsApp, even before they can do that. So again, a chat box service is also essential in your EMR when you link it online. So commonly access services should be available there, like case summary, medical certificates, fitness certificates, etc. So they should be able to download and then do whatever they want with it. Now sending greeting messages, wishes, these were all being done with SMS before, but now with multimedia being enabled in WhatsApp and everything, you can even do better messaging with respect to sending personal greeting wishes, anniversary messages, get well soon messages, alerts, etc. So they should also be able to edit their profile. So sometimes what happens is their address changes, their phone number changes. So they should be able to log in with a user ID password and do some basic changes so that their data is always maintained in an accurate format, and it is not inaccurate with respect to, especially when you send this data to insurance. They should not have any problems. it's also easy for us to ask them to upload their own certificates or reports, and even their Aadhaar cards, these kind of things, rather than having to ask them for their Aadhaar card in the reception, where they may have been prepared for this, a question like that. They may not be prepared also. So when you do it online, most of the time it becomes a mere formality. So they just upload an Aadhaar card, and then it's up to you to whether you want to verify it or not. So patient verification also becomes easier when you integrate an EMR with all this functionalities. And the last thing is here, we should also be able to get them to make payments online. So now most of the payments that at least we receive is online through Google Pay and Phone Pay. So if you can integrate it, and even before they come, if they are able to register themselves and then make the consultation payment and everything, then the EMR has served a greater purpose. The next thing that we need to do is automate administrative tasks, like how I said, send the registration before the patient comes in through a link. So where he can autofill his demographic data and submit, make the payment. He is given a token number and a time. So when he comes in, he knows that his waiting time is going to be around 15 minutes. Most of the time we do mention that his appointment time is not the appointment time with the doctor. It is his entry time into the hospital. And once he enters it, he can expect a waiting period, the entire process to be completed in around, say, maybe half an hour to 45 minutes. Now, the next thing that we need to do in all our EMRs is how to integrate with Google Maps. They have special APKs for that. So the most up to a basic limit, it is actually free of cost. So if you can map your patient population in your drainage area, so you will know from where you are getting your patient. And for example, if you are getting a patient from a particular locality, then is the reason why you are getting more patients from there, and the reason why you are not getting so many patients from the other locality. So you should be able to analyze this kind of a data with using Google Maps. So there is also functionality of live location for that can be activated for 15 minutes prior to the appointed time, and this is enabled till about 5 minutes after the patient has exited the system. This is very important because especially in large hospitals, patients may after registration, they just don't sit in the waiting hall. They may go to the toilet, they may just go to the canteen, so when you call them on the speaker system, they are just not there. They may not be hearing also, because many of them may be hearing impaired. So if you have a live location tracker within the hospital, you will know that this patient is actually in this particular zone, and then you can actually ensure that he is called up there. At least you will know he is in the hospital or he is outside the hospital. So this also should be enabled in the EMR as soon as the patient registers and the appointed time is given. Now, when we say automate your administrative tasks, you can also use a lot of artificial intelligence to actually weed out these duplicated entries. Sometimes name may be duplicated, the phone numbers may be duplicated, the names may be entered wrong. So the AI actually will suggest this kind of errors, and it will also help us in weeding out these kind of duplicated entries, so that the database is maintained in a correct format and it is accurate as much as possible. It's not possible to do it 100%, but it is as much as possible it should be done. And the next thing that you can do is you should be able to as I told, you can even take when the patient enters the basic data, autofills the basic data from his smartphone, it is more likely to be accurate. And second is, if you can upload a anti-segment photograph or a link sent from his WhatsApp, it gets stored in your EMR, so that tomorrow you always have this problem of where the patient may dispute that he was having a different problem, and then you actually prescribed a different medicine which was not related to his problem at all. So you should be able to store his anti-segment photograph, even if it is linked to a teleconsultation module. And sometimes even in WhatsApp, if you just store it in WhatsApp, it may be deleted, because your storage space may be running out, so you may delete all your gallery photos. So it's always better to store it in an EMR, in your own hospital's EMR, and have allot a separate registration number if you're doing teleconsultation for this, and storing it in your EMR. And it should also, most of us complain that EMRs are reducing us to a glorified typist. So we are spending more time in actually entering the data rather than seeing the patient. If you see, so for 10 minutes, you spend 15 minutes on on entering the data. So nowadays AI can actually suggest various possibilities, because once the patient sends in his symptoms, you can have a questionnaire where he can just sends all his symptoms. So the diagnosis can also be suggested by the this thing from a list wherein you can select. So and based on this, you can it can also auto suggest various further investigations, or medicine prescriptions. You can, whatever is already pre-fed into the system, it can suggest. So this kind of auto suggest feature can be very much useful, and it will also help in reducing your overall feeding time, data feeding time into the system. So the next thing that you can do to enhance patient experience is, when the patient comes in, he has to be informed about the expected waiting time. If is it going to be 15 minutes or 20 minutes before he gets to see the consultant. Now this is going to be through the form of a regular alert, which can be sent to him frequently. Now, because the waiting time is not going to be the same. For example, the first waiting time he may be willing to spend 15 minutes, but then after he's dilated, if you ask him to wait again 15 minutes, he is not going to wait. He will only wait for 5 minutes, and later on, when he's ready to pay for the surgery, so it's not in your interest to make him wait again for 20 minutes for him to pay. So these are things that have to be automated, and in a manner in which it does not cause friction to other patients. So for example, another patient may have a problem if he sees that a patient who was brought in later is entering the chamber for much faster. So automation helps you in reducing this kind of a friction among patients in the waiting hall. And even in diagnostics also, when they move from module to module, so what happens is, when you have live tracking or location tracking, the next module, if for example, if he is moving from, say, the consultant's chamber to the diagnostic to the counseling chamber, now the counselor should be prepared to receive the patient with the minimum waiting time, and they should be knowing that the patient is going to come. Or if they are waiting, if they have 5 patients waiting outside, then there should be a token system allotted, so that the patient knows that his number is going to come in the next 2 minutes or so. So this kind of a system enhances the confidence of the patient in your hospital, and actually helps in conversions. You also, at the time of entry itself, you can even give the name of a dedicated relationship manager and their phone, so that if the patient has any trouble at any given point, he can always call up the relationship manager and ask them to troubleshoot. For example, if he has been asked to come for a particular investigation, and if he has been told that he has to make a payment of, say, 5,000 rupees for the particular test, and then if the actual at the time of actually getting the test done, if he is being asked for 6,000 rupees, now there will be a problem wherein he will say, no, but it was told to me only for 5,000 rupees. So these kind of things have to be, there should be a dedicated relationship manager who should be allocated to every patient. And that actually, they will actually troubleshoot. They will actually do the verification immediately, because they will be responsible for end to end. They will know what is happening with each of the allocated patient. So this system will also help EMR. Integration of this system with the EMR will also boost the confidence of the patient in your overall hospital management software. And say, next thing is, if you do, the question is, what happens when patients don't have smartphones? So many hospitals implement these self-service kiosks. They will have where touch screens, where patients can actually so do certain amount of registration and services and all themselves using the touch screen. Only thing is that sometimes there's a queue in front of this kiosk, defeating that very purpose. So if the queues are being there, then you must have more touch screens to actually be implemented. So as I told, next thing is the patient movement from one station to another. You can track it in the same manner how you are tracking Swiggy, food delivery, or any other Zomato, So this kind of tracking is actually possible. So you should know whether sometimes patients may say you may be closing your OPD at 1 o'clock. At 12:45 they'll say, I'm just coming in another 10 minutes. Can you? It's an emergency. Please, can you ask the patient doctor to stay back? And then they'll come at only 2 o'clock. They would be saying that just waiting for, they'll come in 5 minutes. So you can ask them to send a live location or tracker so that you know where they are. And depending on their location, you can actually decide to stay back or give them another time for a slot for a consultation. So the next problem that you face is in handling visitors. So they just want to come at their own times, and then most of the time, so there'll be one patient but 10 visitors along with them, and they occupy all the spaces in the hospital. And you need to have an automated system that regulates visitors. So one way to regulate is by giving them a entry pass that also regulates their entry into the lift. So, and you have a specific time, entry time, and for example 4 o'clock to 6 o'clock in the evening. So during this time at 6 o'clock, that pass will no longer be valid on the lift. So they will have to use the staircase, or and then their exit also will be at the exit. You can take back that pass. So you can also integrate this with your EMR solution so that it is linked. And if anyone wants a higher number of passes, you can always make it as a paid utility. The next thing is you can also integrate exit details of the patient with the parking system, so that the parking, if they have drivers or valet parking, then they are ready with the vehicles at the exit, so that there's no rush or there is no jam in at the exit gates. You can also institute a system of rewards in terms of redeemable points. So this is a completely different topic, and it will take a lot of time for us to dwell on it. But then you can have patients who are buying glasses from you. You can give them a system of reward points, and then they eventually come to you for LASIK. You can actually minus those reward points and then charge them a little lesser. So that's just one way. We can use this in the same way for various other services also. Then you also can integrate a red listing system. So a red listing system or a hot listing system would basically ensure that unruly patients or abusive or violent patients who are talking to you for foul mouthing you, they need to be red listed, so that when they come next time again, or when someone who's related to them comes next time, you are actually better prepared. So most of the time we don't have systems in place to actually recognize them. Nowadays, when people wear masks, we are not able to see their faces, so their photos are not captured in our system. So you need to have a red listing system for unruly, abusive and violent patients. So one thing that
sorry to interrupt you, sir. The time is
okay, so I'll finish in another 2 minutes. So the thing is, we need to make sure that we are optimizing the wait times and reduce the data entry times for the doctor, and then institute a token system for each station, so that patients are aware of how much they have to wait before they get the promised services. Provide an e-consent for various diagnostics and procedures after the phone number is Aadhaar verified. And then you can also have self-service tasks to be automated at the kiosk level to reduce the burden on our reception staff, and then the waiting times also. So Google mapping of patient population will help you in many ways. It will help you in marketing, it will help you in analysis, data analysis. So you can actually find out what is working and what is not. You should also have conversion metrics between OPD, diagnostics and procedures. So if the footfalls are good, but the procedures, the income from the diagnostics and procedures is not good, then you know where the problem lies, and you can actually institute remedial measures. You should also analyze the feedback forms, because many of the changes that we do comes from patient feedback. So for example, they say that this area of your toilet was not clean, this area and this particular staff was rude. So when you talk about all those things, you know where to take remedial action. Sometimes they're not telling the correct version. So you also have an opportunity to talk to the staff about it and find out the true version. So that if they go and complain on Google, you will know where to how to handle it. So you also should have an in-house rating system of employees by the patients. So when they leave the system, they are actually rating your employees, not in terms of their cordiality, you know, and accessibility and other things. So they also have to record your marketing activities and how the patients are coming in, whether they're coming from word of mouth, whether through pamphlets, through online marketing activities, etc. The EMRs should also analyze the patient load during peak and off-season peak times along with seasonal variations, so that you can optimize your HR. You can take more staff for during the peak times, and you can have less staff during the off-peak hours. If you know that traditionally during festival season you're going to have low volumes, then you can always ask the patients. You can always give your staff off times during those festival seasons, so that you're not putting your hospital functionality at risk. Then you can also analyze the referral activity, your traditional referral sources and all. So that will help you in making sure that your marketing is up to date. So these are some of the changes that I have sort of tried and to incorporate in our systems. So we will be coming out with that kind with the system called as iSoft, maybe this, shortly sometime next year. So maybe if anyone has any questions, I will take them on.
Sure.
Right.
So thank you very much, sir, for the very exhaustive talk. This really calls for a complete workshop actually, and just 10 to 15 minutes is not enough. I request if anyone has a doubt to take it up in the discussion section. We've already overshot the time. The last talk is Dr. Jaitra's, and he has given us a recording. I request the chair and moderator of the next session, they must be already waiting to give us those extra 10 to 15 minutes, and thank you in advance. Dr. Jaitra is MBBS from JJM Medical College, Davangere, and Diploma in Ophthalm from Arvindai Hospital, PG Institute, Madurai, Tamil Nadu. He's the innovator of Zeiss Reticam, and he's the co-founder of Ray D8 Healthcare Innovations Private Limited. He's a YouTuber, digital marketer, and TEDx speaker. His talk is on use of Excel sheets in managing and promoting ophthalmic practice, and request the tech team to play Dr. Jaitra's
Okay, doctor.
talk.
Sure. Yes.
Good morning, everyone. Myself, Dr. Jaitra. I thank Karnataka Ophthalmic Society and especially Dr. Ellen Kumaran for giving me opportunity to talk on this topic. So my topic will be Excel sheet in ophthalmic practice. So it's quite some time I'm using Excel sheet for my accounts and electronic medical record. Especially practically I'm using Excel sheet, electronic medical record in my hospital like past 8 months. In this presentation, I'll be showcasing you, I'll be sharing with you what the features of Excel sheet which can be used for preparing medical record, medicine prescription, for spectacle prescription, discharge summary, and I do use PPT slide for fundus photo. So after some time, this procedure appears to be slightly tedious compared to electronic medical record, which is commercially available in market. But there is no perfect EMR system in the market till now. And in future, definitely, I'll be shifting to EMR, commercial available EMR. But till that time, I'm using this system. And in the presentation, in the end, I'll showcase you, I'll show you how when the patient comes into my hospital, how my system works. Let's go to my presentation. Excel features I will show you here. So 1 and 2 you can select like this and pull it down and you can get the numbers. That is one thing. Another thing is this is the date. You can see here the date is here and I can pull it down till December 31st and it goes for January. So these are some of the Excel features, and the sum you can see here. Select like this, and if you go to the home page and auto sum, so it adds like this. Or as there is another feature is equal to sum bracket, add like this, and enter. You can see. So these are some of the features which I'm using it. So let me show you another feature, drop down list, which I use. This cell, if I want a drop down list. Okay, so what I have to do, the list is here. Let's suppose the list is here, right eye here, appellate. These are the drop down list in each block. So what I will do here in this block, I have to choose from the drop down. I'll go to data, and here data validation, click here on data validation, change this any value to the list. So this comes like this. Then I can select from this also. Okay, if I say okay, you can see these are the dates coming. So if I want to edit data validation, so this is how it is. I will delete this. Then I am going to go here and select right eye, left eye, or both eye. Say okay. So this data validation is there. So same thing I want to copy in some other cell also. You can just say Control C and I'll put that thing here and enter. You can see here same thing has come. So for this cell I would like to do data validation, drop from list another list, data validation from any, go to the list, click here, then go here and I'll select this list. Okay, now you can see here from this list what increase this thing. From this list I can select whichever I want, right eye, left eye. So this I use it for medical prescription. This another feature I would like to show you is this. So I want data which is there here to be written here. So what I will do, I will select this box, keep is equal to, and I click this box. You can see this I-15 box and I enter. So if I whatever I have written here left, you can see it goes changes here. I use Excel for my discharge summary also. This is my cataract discharge summary I have prepared in Excel. So it has 3 sheets, that is cataract and summary, medication, and you can see receipt. So I'll just show you. This is you can see 910. Here also this 910 is there. So I'll enter things in the only the first sheet and everything changes in the all the sheet. You can see MRD number I'll write 999 and enter. You can see here in receipt also it got enter. In phone number is 0 and name is 0 here. So I'll enter the phone number 980000 and I write my name. You can go to the receipt, you can see it has changed. So if we come to the date, so I'll just enter today's date, that is 5/12/2002021. You can see date of admission, date of surgery, here next appointment. You can just check out here things. 10/10 is the next appointment. I press enter. Date of surgery, discharge if changed, and you can see next day appointment is next day. You can see C18 plus 1 it is this C18 plus 1. So date of surgery I have written date of surgery plus 1 is the next appointment date. And you can see the medication. Go to the correct medication. You can see 512. It was in the October, now it got changed. 512 6 times per day for from 5th to 14th. And from 15 to 24 and 25 to 23. This is how, and the timings have written. You can see here, this is cataract summary page and C15. So C15 is the date of admission. What else then? Okay, you can go here. That is one. If you come here, it will be D6 plus 9 plus 9. For 10 days I am giving. This is D6 plus 9 I have written. And if you come here, E611. This is E6 block plus 1, and here if I come D7 plus 9, like that it changes. You can see here again what I have done, whatever the date comes here, this will date come here, and this one is the last day of this one is like this. So I'm using this as discharge summary, so I enter in the only on the first page, and most of the things get changed here. So if I this right left eye it is there, so what I'll do is right I change it right eye immature cataract and I enter. You can see the below this page also got changed, and I will go to the receipt. You can see here receipt 15,000 for the right eye phacoemulsification cataract surgery, and here when if you change the amount, if it is 16,000, this is one for few things we have to manually do it. 20,000 if you change, you have to change it here 20. So there are some things which you have to change it manually, or else you can see the first in the first page I entered the date, MRD number, and everything. So it all got changed. Here also you can see the receipt date is 5/12/2000. I'll just change. If I change 10/12/2021, everything gets changed. In the receipt also you can see it got changed. So this is how I'm using in disaster summary. Fundus photo report, I use PowerPoint slide to give the report. So I have made two slides here. If I want to make a blank, these are blank file, this is a basic file. And if I want to make more files, I copy and paste like that. I can make more slides. What I will do here, I want to select the image. Let's suppose I'll select this image, and for other eye, I'll select this image. So right and left eye, I want add more images. So let's suppose I just add this one again. I'll add again more. Here I can just type the date, patient name and details, or copy and paste the details, or comment, and I can give the report. So when patient enters our hospital at the registration, at the reception level, he is registered. Let's suppose, let's take my name only. So if this is done on the smartphone, there are some mandatory fields, some are non-mandatory fields. Here we register and we submit. And this is Google form which I have integrated on my website, hospital website. And next, what I'll other things I use is Google Drive, and from the Google Drive, Google Sheets, and this is a small PDF mergers. These are some things step by step I'm going to use. The moment the patient is registered at this level, when I go to the Google Sheet, you can see here my name, my phone number, and everything. It is here. So here what I do, I copy this, then I paste it on my another Excel sheet for my record purposes, make it in the center. You can see there is a border here. I take out that border. Then I do examination. See, you can see another things which I use is scanning. If the patient has previous scans, a scan record or anything, so I scan that part. Then if I want to give prescription to the patient, medical record, here I have made in the Excel I have made here. This is how my medical record will be there. And if I want to give only medical prescription, this is how my medical prescription is there. And next is spectacles. Sorry. Here is a spectacles. This is how my spectacles is there. Let's suppose I'm giving for this patient medical record, medicine, and prescription also. You can see I scanned it and it has come like this. Now it came. Okay. Here I'm going to rename this first. I go to my medical record. I copy this MRD number, phone number, and patient name, and go to this one of the first file, rename it like this. I do the renaming. Then we'll go to the medical record. Here, let's suppose I have filled some of the medical records. So, and you see name, patient name, and MRD list. So I'll go to my MRD list, copy here, Control C, then I paste, make it bold. So I print this. I can give my printout directly if it is only this this is there, or what I will do, make it into PDF. I print it, I give one name, then medicine sheets. Here also I copy here. You can see same thing I'm going to copy, and I go to the medical prescription and I paste it, make it bold. This is one thing I am doing here. See, there is a drop down list. Right eye, left eye, both eyes. And here I want to give medicine, eye drops, ointment, dosage, how much duration. Then I'm going to ask the patient to review after 1 month. Like Control P, print out and save it again. Let's suppose say 500, make it as P. It is as prescription, medical prescription, and save it. If I have the next, if there is spectacles, for spectacles also, if I'm giving again, you can come here, Control C, and go for medical prescription here. Make it bold. So I'll write it. My medical prescription. Here I have the drop down list. That doesn't correlate, that's fine. Add and Control P. And this is my medical prescription. I'm saving it again as PDF. Spectacles. Next, I'm going to use online PDF, this thing, merger. I select all this. Choose and you can merge it. Merge it, download it. You can see this how it is merged. All the file which I can give printout. Then I can go to the downloads. I can copy. So these are all my list of MRD. All the patients which are given prescription or as PDF, these are all the PDF. So when the patient comes next time, I want to use this file also and the previous file and the present file and merge it and keep it. Thank you all for the patient listening. To conclude, yes, this system appears to be tedious, time consuming. In future, if I shift to new system, then also I'm going to continue with my discharge summary because I feel it is complete. These templates, if anybody needs, please contact me. I would be happy to share with you. Once again, I thank KOS and Dr. Ellen Kumaran for giving me this opportunity.
Wonderful talk again. And even I would like to thank the KOS and Dr. Ilan for this opportunity of conducting this session on technology in Ophthal. Thanks to all the participants. And let us leave it open for the next set of people now. Dr. Uma?
Yes, Dr. Jayashree.
Okay, thank you for accommodating and giving us this extra time. Please carry on with the quiz.
Thank you
Thanks to all and have a great remaining day of the sessions. Thank you. Bye-bye.